Hey YouTube, it's Marlin's 420. This is Marlin as always. Uh, Today it's Sunday. Today I was going to talk about my experiences with temporomandibular joint disorder, or TMJ, TMJD, as many people refer to it. When I first started this channel, or when I was coming up with the concept for the channel, the TMJD and the experiences I've had with it were a big part of why I wanted to do this and start trying to reach out to people, let some people know that there's a lot of other folks out here dealing with the same thing. And even though this particular disorder is a boogeyman and very hard to deal with, there is hope out there. So I'm just going to go over one thing that I keep seeing a lot on Facebook and other places is people have this problem, they get diagnosed, they want a quick solution, they want it dealt with, and one of the first modalities, the first things that people say to do, the first thing that they're encouraged to do is surgery, which isn't surprising necessarily because a lot of the people who are going to be diagnosing this disorder are oral surgeons. And of course, a surgeon is going to want to cut. That's what they do. I had surgery, arthroscopic surgery on both of my joints about 10 plus years ago now. And the surgeon who did it here in Birmingham, Alabama, was or is considered one of the pioneers of arthroscopic TMJ surgery. He was one of the individuals who pushed the idea for surgical intervention first and quickly for TMJD. I went to 6 or 7 other oral surgeons who were all very well known throughout the Southeast, and they all kept pointing me back to this individual. I will name him eventually. I'm not going to right this second. I had the surgery, and every day, every hour, every moment of my life since then has been a fight against pain and anger. He absolutely ruined me. Now, that's me. I know for a fact that there are other individuals that he did surgery on in his practice that were fine. They loved their outcome. They were happy. Almost every single one of them was minor issues to start with, and he did corrective surgery for somewhat minor issues as far as you can compare an issue needing surgery. Mine were pretty badly damaged from one fight, and then a car wreck, and then a bad dental session. Both of them needed to be done, and a lot of his other patients that were happy only had one done. The problem with having both of your joints fixed or having surgery done to them at the same time is that they are the only joints in your body that must mirror each other. They have to mirror in order to work properly. And if they don't, you're going to have pain, you're going to have dysfunction, which is what I have constantly. What I would suggest to anybody who is being diagnosed with TMJD or is having issues is first and foremost find a doctor who's been treating TMJD with non-surgical intervention for a long time, years, many years. There have been a lot of dentists and other doctors who have jumped onto the I treat TMJD bandwagon rolling out all kinds of old modalities, snake oil, and everything else. TMJD is one of the most dangerous, non-life-threatening disorders to try and get treated, because there are so many differing opinions, there's so many different procedures, there's so many different modalities, there's so many different ways that other different people want to try and attack it and think this is the best way to do it, and there is no consensus. As far as surgery goes, our microsurgery and our ability to deal with joints this small that are so intricately connected, and then forcing them to work the way they did as God intended and we were born with, is just extremely difficult for a surgeon to do. I don't know, I personally don't know how well it can be done on a consistent basis at this point in time, even in 2024. So if you're having issues with TMJD and you're in the process of getting it diagnosed or trying to get it treated, and you're getting diagnosed by an oral surgeon, almost certainly if they treat it or if they specialize in TMJD as an oral surgeon, they're probably going to want to do surgery. Surgery is permanent. It cannot be undone. Think about all the people who have neck surgeries, back surgeries, that have to go back again and again and again because they don't work. And the temporomandibular joints are probably even more complicated than a lot of that. It is a perilous surgery. So I would implore, do not do anything to your joints or your body or your mouth or whatever that affects your joints that cannot be undone, that can't be tried and then say, okay, that's not working, let's go back and do something else. As soon as he cut into my joints and started rearranging things, those choices were over, and I have to go forward with what was done. It'll probably take another actual corrective surgery to fix mine, but I'll talk about the full story another time. So that's it. 10 years of experience, pain, see 20 plus different oral surgeons, and many other different doctors who do other modalities. Do not have surgery on your joints as a first option. Now there are exceptions always. With me, with Marlon, you're gonna find I am not a black and white person, despite some of my views or what I may say. This is not a black and white world. I live and understand the areas of gray. So there's always gonna be exceptions, but for the most part, that's what it is. So I'll be releasing a video about the full story of my temporomandibular joint journey, what I've dealt with and where I'm going soon, but I just wanted to release this one today because I see this all the time on Facebook and other places, and a lot of people are being hurt. So anyways, let me know what you think, please, in the likes, comment, and subscribe. Give me your experience. Let me know what you think. Let me know if you've had surgery or if you tried other modalities first. I'm Marlon. We'll talk to y'all very soon. Be safe and be well. Cheers.